Today's conversation is one so many women are curious about, yet often feel unsure how to talk about it openly. As we age, our faces change. Skin changes, facial structure changes, the neck softens, jowls appear. And for many women, there comes a point where they begin wondering, when is enough with treatments, and when does surgery become the better option? Dr. Jeremy Hunt is a plastic and reconstructive surgeon who has spent years working in facial aesthetics and surgery. In this episode, we're talking specifically about facelifts, what they are and who they're for, and how modern facelifts have evolved, and what women really need to know before considering one. This is an honest, grounded conversation around aging, aesthetics, and how to navigate this space without losing yourself in the process. Dr. Jeremy Hunt, welcome back. I'm so pleased to have you back here today to talk about all things facelifts.
Thanks, Tracy. Pleasure to be back. And hopefully we can have a nice discussion and clear up some of the confusion around a very common procedure.
Absolutely. And it's so funny. I went for a coffee the other day with my husband, and there was a group of women at a table. They'd probably be in their late 60s, early 70s.
Yeah.
And they were discussing facelifts. It was quite loud. They were talking about, and who do you think's had it done? And they were talking about all these celebrities. And I think it's often a taboo subject with a lot of women. We don't like openly discussing it because I just think there's this sort of aspect where it's like it's shallow, or we're not accepting ourselves as we age, or blah, blah, blah.
Yeah.
But there is a genuine intrigue across the board of all ages, I feel.
100%. I mean, you never want to ask a woman her age or her weight, and no one wants to admit they've had some sort of elective surgical procedure, but the awareness of what's around and the understanding of options is just increasing. So more people are discussing it, more people are considering it. And it's one of those of trying to work out the facts through the fiction of everything you see online. And social media has led to this awareness where people do know what's out there and they do know what's available, and they're asking questions.
Mm. Do you think women are approaching aging differently now compared to 10 or 20 years ago?
I do. I think that quality of life has become a priority for all of us, and part of quality of life is, one, being healthy, but feeling good about things. People are giving more consideration to options. People are exploring ideas, and there's a much better understanding in the community, and there's a lot more procedures available. It's just a case of making the right decision for the right person, I think, at the right time.
Because I feel like it's not, for women like me at 50, it's not about looking younger. It's more about being a better version, right? Like looking more
100%.
fresh or healthier or less tired, or sort of
100%.
matching how you're feeling, I guess.
Yeah, 100%. So I think maybe in the past there was a bit of a tendency to walk out looking like you'd had something done. Maybe that sort of Hollywood concept of, oh, she's had this done. But at this time, people don't want to look like different people. People just want to look like a fresh is really the key, fresher, younger version of themselves. And they don't want to be noticed for having had something done. They just want to be noticed for all the right reasons, not the wrong reasons.
Yeah, you look well, you look fresh.
Absolutely.
You've been sleeping well, eating well,
Yeah.
not like, holy shit, have you had a facelift?
Yeah, totally.
Yeah. So do you think we're steering away from fillers and Botox and leaning more towards surgery? Like, what are your thoughts on that? That's my vibe across how it was, say, 5 to 10 years ago with the fillers. Is that what you're saying?
Well, I think fillers and Botox, they're great tools. Surgery is a great tool. And then the aging process is a bit of a spectrum. So in, 30s and 40s, the right tool to get the job done might be Botox and fillers. But then there's a point where with the aging process, that's not the best tool to get the job done necessarily. And the trap is to keep trying to hammer the nail in with the screwdriver when it's time to put the screwdriver away, reach for the hammer and do the job properly. So that in my practice, Botox and fillers have a big, big place, but it's the case of the right tool for the right person at the right time.
Are women becoming more educated now about what actually causes facial aging?
Oh, absolutely. I think it's great.
It's
See, there's
everywhere.
nothing. Yeah, it's everywhere. There's nothing as good as and as pleasurable to deal with as an educated patient. So patients who have an understanding will then have an appreciation of which procedure will get which result. They have an understanding potentially of the limitations of some of the procedures, what the outcome's going to be. So all the information that's out there is fantastic. It's just there is a lot of information, and the information channels we have now, they are wide and they are deep, and there are many of them, so that people can head down YouTube, people can head on Instagram, people can head down the internet, and they will come across things that they may think is the answer for them, but they won't really know until they speak to someone who has an understanding of all of the options, who can then say, you know what, although this seems the right plan, this plan is a better idea for you. And I think that's the key to surgery. Surgery is not about an operation. It's about, discussion with the patient having understanding. It's the journey from the first time they inquire on the internet all the way through to 12 months after the operation, to ensure that along the way they get the experience that they deserve and the outcome they're looking for.
And what would make it easier is having good quality skin, right? And not having
100%.
a face full of fillers, I would imagine,
100%.
if you're going in. Yeah.
So, the things that make our job easy is a clean slate. So if you have good quality skin with minimum sun damage, then you're a great candidate. You're off to a flying start. So things like a lot of sun damage, smoking, they're always things that we need to consider before the procedure and discuss the limitations that those problems then provide in terms of the outcome. A lot of use of, as I say, fillers and Botox, great tool, but a lot of use of those can be problematic. A lot of use of some of the energy devices that are around that will use heat to tighten skin. Tightening of skin can create
Can you give me
scarring.
an example of what that is, just to make sure I haven't had it?
Well, yeah, it's always dangerous. Brand names, but
Okay,
a lot
right.
of them will use radio frequency. Let's say so. Radio frequency and heat is great if I say to the patients, it's like if you throw a steak onto a barbecue, it will shrink. If you throw an egg on the frying pan, it'll shrink. If you heat collagen, it will shrink. That's great, but you don't want to shrink your steak to the point where it's a crispy piece of cardboard. So that a little bit of energy device can be useful, but if someone has just kept using the same tool again and again, it can create problems for us when it comes to scarring and surgery. So a clean slate, a healthy slate gives us the best chance to create the best result we can.
Interesting. So why do some women age more dramatically through the lower face and neck more than others?
I think, well, there's going to be a little bit of a racial tendency to it. There's a genetic component to it. So if you do look at your mother, potentially you will head down a similar path genetically, which can be encouraging. It can be disturbing. I think that we live in a great country with great sunshine. Problem is sunshine, high UV exposure. Northern European, blonde hair, blue eyes, pale skin, not built for the Australian sun, means that all of the stuff we did, particularly when we were kids, has some sort of carry on into those later years in terms of loss of elasticity in the skin. So that different races will age in different ways, different families will age in different ways. And then the things that you have environmentally subjected your skin and body to will affect it. So smoking is obviously very, very bad for skin. A good diet is good for skin. A good skin routine is good for skin. And then the use of, a good skincare program is imperative to minimize and try and reverse the damage from the past and then prevent ongoing damage to the skin.
Is there a right age for a facelift?
That's a good question. So I think the right age is everyone's going to have a trigger point. Everyone's going to have a moment where they're going to look in the mirror and just go, right, that's it. I'm off to get some information. And I think that trigger point comes for different people at different times. So when I'm sitting down with someone, the priority is going to be, what is your primary concern? What is it that you don't like the look of? and then we'll discuss the options to try and address it. So for some people, the problem in their 30s is the same problem that people might have in their 50s and 60s. So although 50 is sort of deemed as this pivotal point where you move from non-surgical to surgical, there will be times where the right tool to solve the problem in someone in their 30s is going to be some sort of surgical procedure. And if it's on the face, it's likely to be some sort of facelift, because the other tools are just not going to get the job done. They're not the right tool to fix that particular problem in that particular person. So I think it's when someone looks in the mirror on a frequent enough basis and it's causing them enough concern to want to go and ask the question, then they just need to be informed as to the options, and whether they go ahead at that point or they go, you know what, thanks for the information. I'm now crystal clear. I'm sitting tight for 5 years. I'm like, that's fantastic. Sit tight for 5 years. See you in 5 years' time and we'll have the same conversation.
And that's why I think this podcast today is really helpful, just for those people that are curious and just have those questions. I think it's just really good to make an informed decision with the information that you have.
Yeah, absolutely.
But are women seriously having them in their 30s?
There will be times, very, very uncommon, where, for various, so let's just say the face comes in different layers. We have skin on the outside. We then move down to a layer of fat that's incorporated into a layer of the muscles. And below that will be the underlying bone structure. So there may be occasions where there's not enough structural support from the bone to support the soft tissue, which then leads to soft tissue dropping earlier than it would in someone with a more robust bone structure. So they're the candidates who you will consider whether a surgical procedure is going to be beneficial or not. So it's not common and it's very selective. And it's not something someone would go into lightly or flippantly, but it may on occasions be the best way forward for that patient.
And I believe as well, like when you go to the gym and you're training and you're doing things to make your biceps bigger, for example, there are things that we can do to help the muscle laxicity in our face. Do you agree? I mean, obviously, there's only so much you can do,
absolutely.
But just help extend.
So if you're exactly right. If you think that your core, your abdomen looks good because you've got tone in your abdominal muscles, then the same applies to the arms. The same applies to the face. So maintaining tone in those muscles is definitely going to be beneficial.
And if you're stressed in your jaw and your neck and that sort of dragging down, pulling the fascia down, that all makes sense to me.
Totally.
So there are things that you can do so you're not having facelifts in your 30s. Perhaps.
Yeah, 100%. You're right. We want to try and avoid doing facelifts in 30s. Yes, we want to try and honestly, the trick to this is you really want to ride the non-surgical train as long as you can, and then get that tool out when the time's right.
Are there ever any patients you say no to?
Yeah, always.
Yeah.
So there's a bit of a saying in surgery that the good surgeon knows when not to operate, and when not to operate is when surgery is not in the patient's best interest. Professionally, if someone makes a proposal to me about doing a procedure and I hand on heart think that this is not in that patient's interest, then that's the way the conversation heads. It's a conversation about, I honestly do not think that this is in your best interest. And you may not like what I'm about to tell you, but it's because I care and I want you to have good quality of life. So you can take my advice or not, but honestly, I don't think this is for you. I'm hopeful that people will listen to that discussion, and maybe if they seek the opinion of enough practitioners who think the same way, they'll start to hear the same message, and maybe they'll think, you know what, 10 out of 10 surgeons can't be wrong on this one. I think maybe I need to reconsider, my position.
Talk to me about mini facelifts. What's the difference between a mini and a full?
So the thing about a mini is it sounds so appealing. If it's mini, it's got to be smaller, quicker, less
faster, less downtime,
all of those things.
Cheaper.
100%. So the problem with the mini anything is that the mini anything is going to be less effective than the full. It's going to not last as long as the full. The recovery will be quicker. And then it's just matching the patient's expectations as to which procedure is going to get which result. So I'm cautious about terms like mini and quick and lunchtime and things like that, because they all infer that it's going to be a lesser procedure, which often it is. And if it is a lesser procedure, it's not going to last as long.
It'll be lesser results.
It'll be a lesser result. And although, a procedure might be able to present, here's a result of my mini facelift. Here's one out of 100 patients. And that one is the best one I've got. And that patient's happy, but 99 of them may be very unhappy. So it's about meeting expectations and matching the procedure. But it does make it very appealing from a marketing point of view to call it mini or lunchtime or super fast recovery technique or something like that.
It's almost like a first step, isn't it? It's like, if I'm just going to dip my toe in rather than going to the extreme, maybe I could do that, and that might tie me over for 10 years maybe, and then I'll get the full one. So I think perhaps that's the women's rationale, maybe because they're fearful of not looking like themselves if they go in and get
100%.
So with the mini, to be clear, is that just skin and not muscle?
Often it is skin and not muscle. So interesting that you say it'll just tide me over 5 to 10 years. So the big burning question out there's many different types of techniques of facelift, and which one in our industry, the hot debate is which one gets the best result and lasts the longest time.
Yeah.
So we can talk about techniques, but there's something called a deep plane facelift, which is very widely publicized, said to by many be the best option and most natural, the longest lasting. So there was a study just published in one of our journals that looked at the duration of the deep plane facelift, the Rolls-Royce, the top of the line option. And when you say maybe a mini will get me 5 or 10 years, a deep plane facelift will get you 10.2 years.
Okay.
So anything less than that is going to be mini.
Gotcha.
So I do tend to say to patients, skin's elastic. So you think pregnant woman's tummy, you put tension on skin, the skin will tend to let go. If I put tension on skin and pull it, it's going to want to tend to let go. And you think, how far does a woman's tummy go in 9 months of pregnancy under tension?
Yeah.
That mini skin-only facelift is not going to last 9 months. It might last a few months.
Gotcha. Yeah.
There's the problem. Is it as appealing as it sounds? It has its limitations.
Gotcha. And so deep plane facelifts, are they the same as the vertical facelifts that I'm seeing all over Instagram at the moment?
Yeah, it's an interesting thing. I didn't patent the term vertical facelift, but boy, oh boy, it's like these guys have caught onto the concepts that it's pretty straightforward, really. Gravity goes down, so the solution to the problem is to go up. Don't go backwards. Backwards looks like a wind tunnel. So all of these techniques are about moving vertically upward. And someone's just come up with the idea of calling it the vertical facelift. I'm like, that's pretty clever, because that's what we're all been doing, but it took someone to label it as their technique. I think the tricks at the moment is that in the past, there has been a tendency to pull more on skin and tend to pull backwards, which creates that look,
that kind of Joker look.
Yeah, the Joker look, because then there's a tension point at the corner of the mouth, and as you're going backwards, everything else sort of falls over the top. And there's a few famous celebrities around who have got that said look. There's been a lot of discussion recently about that look and some people's disappointment with the results. I think the tendency now is to want to go vertically. If gravity is down, then the solution is upwards.
Does that mean you're pulling up into the hairline rather than behind the ears?
Yes. And then it becomes a question of how do we get in there to then go upwards? So if you're trying to go upwards, you need to come from above. So we're coming from above in the hairline, potentially. We don't want the ear to go upwards or backwards. So then there's some sort of incision often in front of the ear, because you don't want to pull the ear backwards or upwards with the skin. And that's where we get into, there's probably a spectrum of about 5 or 6 different facelifts that I will do, depending on patient's age, type of skin, where the problem is. And I sit down with patients and much to their disappointment, I actually score them. I score you on how bad 1 to 5 this fold is or the corner of the mouth is and this jowl is and what the neck's like. And then in my algorithm, I will then go, okay, scoring these points, this is the procedure of choice to get you what you want. These are the upsides, these are the potential downsides. And then any movement off that is going to come at some sort of compromise in terms of the result, the duration, the effectiveness. And I'm flexible. I'm with you as long as you're making an informed decision. So I will give people options and give them time to go and consider the options. Quite often they'll come back multiple times because they'll go and see multiple practitioners who'll say, no, this is what you need. And I'm like, well, come back and I'll discuss why I don't think this is the solution to your problem. And so by the time we get to the surgical part, it's a joint decision on which procedure is the right one. Then it's a joint decision on the timing. And then there's a lot of information about recovery. And then we move down the line to get the result that I think will be the best result possible.
I mean, it's a big deal, isn't it? It's such,
That's
I'm just imagining myself going through that process. It is. You understand how women go around and get different opinions and
100%.
it's their face, right?
It's like buying a car, except about 10 times more complicated.
Exactly. Yeah. And it's like buying a house. You have to live in it, right?
Yeah.
So you have to live in the face and the result. So you want to make sure you're making that right decision. So can someone just do the lower face and the neck instead of the full face? And you do it in steps?
Yes,
like I know people
100%.
talk about the lip lift. So could you do a lip lift and then maybe another time you do a neck lift and then another time you do a lower face? Like, is that, can you
100%.
do it?
Yeah.
Is that bad? Is it better to do it all at once?
No, it's better to do it the way you want to do it. So the way you want to do it is the right way for you to do it. And then so I tend to sit down and I break the face up into thirds. There's the top third, which is brow lifts and eyelids. Then the middle third's really the face. And then the lower third's the neck. And if someone's primary concern is, I don't like my little waddly neck, then we're talking about neck lifts. And then I'm inclined to want people to get a result that lasts long enough that they're not back in 12 months' time thinking about doing something else. So then the discussion moves from, okay, if the next primary objective, I would hate to see you back in a year going, okay, now this is the primary objective. Yeah. Maybe we're better off just combining the two, and then I would envisage that's good for 10 years. So I like to do things that in my mind are good for 10 years and go, all right, so I will see you again in 10 years if that's where we're at, but I don't want you popping in every year for the next 10 years having a different procedure because there's downtime. And downtime for people is often the most expensive commodity because any surgical procedure will take you out of the loop for about 2 weeks. So if people have got careers or people have got kids and they've got lots of family commitments, going out of the loop for 2 weeks is a high price to pay. So if you're going to go out of the loop, you want to get something that's going to do you for the duration. But you can definitely break things down into sections. People are somewhat daunted by the said full facelift. It's the cocktail of procedures that's going to get you the result that you want is the facelift for you, and it may involve something that another patient didn't need. So we do put things together in different recipes to get people's specific concerns addressed.
Wow. I find it all fascinating. Have facelift techniques changed significantly over the years? We've spoken about the vertical, gone from being sort of tight to going up. Is there any other significant changes, would you say, in how surgeries have been
I think
applied?
that, facelifts kicked off in the 1970s with a surgeon in Sweden who came up with this concept, self-taught himself this operation, and published a book on it. And the years went by, and as we got more and more understanding of the layers of the face and the way, skin and the fat pads and the muscles move together, it turns out that the guy who published the first book in the 1970s was on the money. He was the guy. And the conclusion at the moment is that it's not so much about pulling on the skin, it's more about moving the deep structures. So if you move the deep structures, the skin just comes with you. And then there's no tension on the skin. So the skin then can't stretch and the scar can't stretch. And we end up with little fine line scars that people can't see. So that philosophy of moving deeper tissues in combination with moving upwards, not backwards, is probably the basis of modern facelift surgery. And then even amongst that, there's probably 4 or 5 very valid techniques that will create excellent results in the hands of different surgeons. And it really comes down to, there are many master chefs around, and the master chefs will use different ingredients to create spectacular meals. But if you try and get one master chef to cook with the other guy's frying pan or ingredients, it's not happening. So too many chefs, totally. So one technique may said to be better than another technique, but in one person's hands, that may not necessarily be the case. So we all get very good at the technique we choose to use, and that's why you see so much of a wide spectrum of options out there. Is there are subtly different philosophies, and there are many international meetings all around the world where there are many hot and heated debates by different camps about which operation's the best, and then some of that washes into social media, and then some of that gets washed over here and a bit over there. And the thing about media is they love a good catch, a good byline, so that someone might be having a conversation and one little word will be snippet cut out and then it becomes gospel. And that can create a few problems out there for us.
The word that you just said before was subtle. And I think subtle is what we want as women, right? We want it to be subtle, but we want it to last.
Yeah, totally.
So is that possible to have?
Facelift.
No, okay, not with the mini.
Done. Okay,
but with a deep plane. So just to be sure, so deep plane is a Rolls Royce. Then you've got, and that's said a full facelift.
Well, no, it's said to be. So I think the brief is in my practice. The brief is pretty simple. You've got a concern, and you want me to address it. And then my brief is that you walk into a room at the end of it, looking like a younger, fresher version of yourself, and potentially no one knows you've done something, and definitely everyone's too scared to ask the question. That's the brief. And then how I choose to do it is I will then take the face down into the thirds, identify whether it's your top eyelids in your neck, or maybe it's the bottom eyelids and your jowls, and then put together cocktails of different procedures to come up with your specific operation that then we do once, and we do it properly, and we do it in a real hospital, and we do it safely, and then we get a result that my aim is to hit that brief, that you walk into the room at the end of this and you look like a younger, fresher version of yourself, not like a different person. And everyone's a little bit scared to ask you, but everyone's sort of quietly going, my God, Tracy's looking so good. What's she done? That's the key. And then if that involves a mini lift or a smash lift or a stitch lift or a deep plane lift.
What's a smash lift?
Okay, we're going to do a basic course in anatomy. This will be good. So you literally go in layers.
Yeah.
They've got skin on the outside, and then underneath that is the choppy layer that contains the fat and the muscle. That's, in our terms, it's called the SMAS, S-M-A-S. And then you really need to move that choppy fat layer upwards, and you're either, I honestly say to the patients, I'm hauling the mattress of your cheek up the hill of your cheekbone. I'm either throwing some ropes in the top of the mattress and dragging it up the hill. That's a stitch or smash type lift, or I'm going underneath the mattress, picking it up and then putting it on the hill. That's a deep plane lift. And I would argue that tying ropes on it and dragging it is not going to create as natural a result as me picking up and putting it. So I'm a deep plane facelift guy because I think that philosophy just creates a more natural result. So, but that argument will go round and round and round and round in international meetings till the cows come home.
Yeah, wow. And one, like you said, one doctor might be better at one procedure, and the chef's got their skills 100%. And what they do, but the flavour's still good.
That's true. And then getting into that deep plane, you're not just scratching on the surface. You're way down in the clockwork.
Yeah.
So you need a level of experience and a level of comfort in that space to be able to not find yourself getting into trouble, I think, is part of it. So,
and I imagine the recovery for a deep plane is because it's more invasive.
Yes.
You're going deeper.
Oddly enough, it's possibly shorter than if you're in a more superficial layer. Oddly enough.
Really?
Oddly enough. Yeah, oddly enough.
Okay.
I tend to tell people that you will hide for 2 weeks. You'll be out of the loop for 2 weeks. You'll be walking out.
And do you still have the chin strap?
Yeah, so you're wearing that day and night for the first week.
Yeah.
You're probably wearing it at night time for the second week, but you're probably still in the house. You're very functional. I mean, you're on the phone, you're on the laptop, you're running around doing stuff. You're wearing a bunny type mask, so you're just not out at social functions.
Mm-hmm.
By 2 weeks, you should be walking out the door looking okay, but not looking your best, looking, a little swollen, like I've been to the dentist, my hay fever's playing up. You'll think of a good excuse. And then by 6 weeks, you should be taking landmark family photos. So you should be walking down the aisle, turning up at major family reunions, taking photos that you would stick on the mantelpiece for the rest of your days. And then for mine, I want that result to be good for, minimum 5, closer to 10 years.
I feel like French women seem to do aging really well. I mean,
they do. Well,
they do everything really well, don't they?
Well,
I mean, I've written books about everything they do so well.
Yeah, they do.
Because they have that approach, that less is more approach, that they still look natural and look like themselves. So do you think there's something in that philosophy?
I think the Europeans are far better at skincare than we are. They're far better at less sun exposure. So it is always interesting. As an Australian, you go to meetings and, I present at international meetings and I'm presenting with, the French and the British and the Americans and the Brazilian surgeons. And at the end of it, they all come up and they go, "Oh, Dr. Jeremy, your patients, they're very, very challenging patients." I'm like, that's called the Australian lifestyle. I mean,
wow.
If you think the women look bad, you should take a look at the guys who just have way too much sun exposure.
I used to model when I was younger and I remember going for this, I think it was like a Japanese Pampers nappy commercial. And I was about 20 or even younger and I had to play this mum and they kept going down because I think they'd asked to have around the 30-year-old mark.
Yes.
And they were like, no, they look so old. We have to go younger. So I was like 18 doing this like Pampers nappy commercial running around with a toddler. But it was interesting. I remember that staying with me. And I grew up in Queensland. Worshipping the sun is, and I look at my 15-year-old daughter now, there is still an element of sun worshipping in these young girls.
And you look back, those days in the sun with the warm sun on your face is some of the best days of your life. It's the price that comes with that beautiful lifestyle that we have. And it's a fair balance. Whereas the Europeans, if it's 15 degrees and it's a hot sunny day and everyone's out sunbaking for those 2 days of the year, and the rest of the time everyone's rugged up indoors and their skin, their complexion is just a totally different animal to deal with.
Yeah. Well, they're getting dehydrated from the heating systems over there. So do you think social media has distorted people's perception of aging and cosmetic surgery?
Yeah, 100%. The problem is social media, you don't know who's got a filter on, full stop.
Yeah,
so you go, look at that before and that after photo. And we're slightly in tune with this is that, to make someone look less wrinkly, you turn the flash up. Perfect.
Oh, yeah. I've got a bright light right now on my face. So people are looking probably going, God, wow, her skin looks so good. It's like, I need to put my sunnies on. It's so bright.
There are tricks. So, and that's just with a standard photo. That's let alone putting a filter on. So that when people want to show a dramatic result, they will tweak it to the point where they get a dramatic result. So that in our industry, in our publications, at our meetings, that's just not allowed. You're not allowed to do that. That's called deception, and you'll get that's unethical. But on the internet, it's a free for all, and then different countries, particularly, will have different rules and regulations about what's viable or not. And some of the images that pop up from some of the countries overseas on facelifts, you just go, that is AI to the absolute max. That person doesn't even look human anymore. They'll tout that as a great result, and some people might go down that path. There's some very famous photos of a very famous mother who's got a couple of very famous daughters who had a very famous operation done.
Yes, I was about to touch on that.
Yeah, her first photos were just, her results were just phenomenal.
Extraordinary. And that's what then the swelling subsided.
Yeah, and it even took my wife to go, "That's a filter." And I'm like, "Oh, yeah. It is too." Yeah, I forgot about that. Because when you're looking, you're just like, "That's amazing." And it is true that that result, in the first 3 months, you will look fantastic because of a degree of swelling. And then as the swelling goes, it's like letting the air out of the metaphorical balloon. And as the balloon shrinks a bit, it might get a few little creases in it. So there are changes at the 3 month mark that won't be there at the 12 month mark. And people need to get their head around that. Is people look great 6 weeks, 3 months after facelift, and then it will settle. And the settle is not a fail. It's just resolution of swelling.
Yeah. The swelling would obviously be beneficial, I'd imagine, for a 50-plus woman.
Oh, 100%.
Where you're like, "Ooh, I look so plump and juicy."
Plump and dewy, like newborn baby. It's perfect.
Yeah. So what's one thing you wish women would stop doing to their faces?
Oh, if one cookie is good, it doesn't mean 10 is going to be better. So if you get your hand into the cookie jar of fillers, like lips are a classic, like a little bit of filler. So as you age, you age in 3 ways. So the quality of your skin deteriorates, you lose volume, and then there's descent of tissue. So you can restore volume by putting volume in. So as you age, the lip tends to lose some volume, and putting a bit of volume in there is a good thing. It's going to be a favorable thing in terms of aesthetics. So if a little bit is good, it doesn't mean a lot is going to be better.
Yeah.
So once you've got your hand in the cookie jar, don't keep just going one more cookie, one more cookie, one more cookie. That's the one thing that I think people lose perspective, and they go from an aesthetic improvement past the aesthetic norm and then start heading off on a different tangent where they're heading off on some abnormal proportion, but things are just getting bigger and bigger and bigger.
Because it lasts a long time. People sometimes go back every 6 months or whatever to get their lips done.
It does hang around. So the problem was when the very, very first came out, we don't release things on the public without appropriate trials and testing. So the testing was done of this hyaluronic acid filler, which is a copy of a carbohydrate that's in your own body. So your body should see it as your own tissue and dissolve it. That's the premise. So, and then the studies were done putting the filler into the skin layer of animals, and it dissolved it in said 12 months. We then started putting the filler under the skin layer where there's less blood flow, and we now know that it will not necessarily dissolve in 12 months. So if you're going every 12 months, you might have 20% left, and then you add another 20 and 20, 20, 20. So there are people who do have a lot of filler that has theoretically meant to have dissolved, that has not dissolved, that then just starts to accumulate, and you can end up with people with crazy big cheeks. And then the other thing is, because it's soft, it tends to almost flow like honey might flow. It's very slow, but it does move. And of course it moves down. So we end up with more volume down here. So overdoing the wrong tool is a bad idea. So using fillers appropriately is good, but overcooking it is not great. That's one of our bugbears.
Yeah. So back to the facelifts, how painful is the recovery out of 10?
Oddly enough, 1 or 2. So recovery after a facelift it's pretty straightforward. Things hurt when they're moving. If you break a bone and it's wobbling, it hurts. So the first thing we do is we put a plaster on it, we stop it wobbling, and that relieves a lot of the pain. So the pain from a facelift is things are not moving once we're finished. It just feels awkwardly tight. So people will say, I just feel really tight and fluey and stuffy. So pain is not so bad. It's more or less like a tight discomfort. And then that's helped by the first couple of days resting upwards and not lying down flat. So I tend to say if you hit your thumb with a hammer, it feels better if you hold it up. So if you're upright, you'll feel better than if you're lying down flat.
Mm. Mm. And what are the scars like, and how long do they take to soften?
The scars are the bugbear. Every time you get in, you have to get out. So there's going to be a scar somewhere. The scars we're trying to hide. We're trying to hide them potentially in hairlines, in skin creases in front of ears, behind ears, down on hairlines. If there's a neck lift, it might involve an incision underneath the chin, behind the shadow line. And then the scars should be as fine as possible. So a scar will depend on three things. It's going to depend on the technician who did the suturing, and we should all know as plastic surgeons what we're doing. We should be doing good technique. It's then going to depend on the patient's biology. So some people will innately scar better than others. We like to grade things. So blonde hair, blue eyes is a grade 1 Fitzpatrick skin type. As we go down darker skin types, we get to a 5. So someone with dark hair, dark eyes, dark skin will innately scar worse than someone with blonde hair and blue eyes. And then there are things we can do after the operation to try and speed up and minimize the scarring process. So we're into massage and silicone and needling and all sorts of different options. But in essence, once the incision's there, the scar will be there. It will be there permanently. The trick is to get the finest scar possible, to hide it as much as possible. It will go through a phase where it's sort of thicker and redder, and it gets thicker and redder up to about 6 to 12 weeks, and then it starts to fade and become finer, and then 12 months is the ultimate final result. At which point, I'm looking for something that you really can't see unless you go looking for it. So if someone's at speed moving normally, you're never going to see that scar. If your hairdresser pulls every single hair back individually, you may be able to see it. That's the sort of result we're looking for.
What tends to surprise women most once they've had the surgery?
That's a good question. I think there's a lot of I didn't realize. I didn't realize that this was something I didn't like. I'll get a lot of I really don't like. So, more throwaway catch lines in our business is like 9 times out of 10, it's the neck, not the face that's the problem. And women know that. So that most people will come saying, I want to do something about my neck. And then you'll go, okay, we'll do your neck, but at the same time, we can do the lower face. And I don't want to see you in 2 years to do the lower face. So we'll do them both together. 1 operation, 1 downtime, see you in 10 years. And they'll often come back going, I just didn't even realize that this was such a big concern of mine and such a big difference is I've got my jawline back. And they're like, I've got my jawline back. Like, I thought I hated this, but God, I love this.
That. Yeah. Wow.
So that's always really pleasing when you get those sorts of results.
Oh, I wish I had done it earlier. Why did I wait so long?
Oh, you get a lot of that. A lot. So when's the right time? The right time is when it starts preying on your mind, I think, is to go and start asking questions. And we do know that people will probably start looking on the internet, and that's probably 12 to 18 months of looking before they'll end up in the office. And then after, I think the hardest part's picking up the telephone, actually. And I say that to all my patients. They're like, you're right. The hard part was picking up the telephone and making an appointment. Now I'm here. It's so much less confrontational and scary than I thought it was going to be. It's actually pretty straightforward. I'm like, it's very straightforward. I mean, we go at your pace. I'm not doing something that I don't think is in your best interest. I'm not doing something that I don't think you have a complete, absolute understanding of. And once we have those hurdles jumped, then we might be ready for some surgical procedure. And it's more than just an operation. It's from the point of contact all the way through for 12 months. The right time's the right time, and it's usually a lot of thinking about it before they get to me.
And like you said, knowledge is power, right?
Totally.
So if they're coming in, they're like, oh my God, it's so big. I don't know. It's like, it's too much. And then once they have the information, they're informed.
Absolutely.
They're like, oh, okay, right. No, I understand. Everything's clear now. So then they can make the informed decision.
Totally. And people will come in going, I need a vertical restore lift. I'm like, okay, well, you can go to the guy who named the vertical restore lift, and I need this. I need this guy's operation. It's like, well, you can go to that guy if you want to, but we do something similar. It's just that he's patented that term. And then clearing all of that noise around the best procedure in the world is part of the whole process of getting people to the point where they go, okay, this is a good plan, and this plan is good for me because I'm different from that person. And
Yeah.
that's the foundation for a successful result.
Yeah. I wanted to touch back on the lip lift, only
Yes.
because I'm curious.
Yeah.
But is that a common procedure that people have where you make the incision under the nose and you
Yeah,
hoik the
it
lip
is.
line up? Because
So
you can get longer in the lip, right? Longer
excellent.
in that,
Yes.
like Homer Simpson, that kind of
Yes.
look. Yeah.
So here's a good story for you. So
Yeah.
there's a guy in the States who I used to work with when I was over there, who came up with a 3D camera, and every time we had a big international American meeting, he would do 3D scans of anyone who wanted to have a 3D scan. So as the years went by, he started getting multiple 3D scans of the same people, and he did it for about 15 years. And then he looked at the changes in the aging process on everybody. And the one biggest variable that came with age was lengthening of the top lip. Isn't that insane? And
Yeah.
then, boom, he comes up with this publication. He's got beautiful 3D graphics of it. And you're like, oh my goodness, how did we not see this?
Yeah.
So then, of course, lip lift became this buzz term. And it's true. Your top lip gets longer as you get older. You lose height in the pink part of the lip, and the white part gets longer. And you lose the little flash of teeth when you're talking. And the trick is to lift the garage door up and do it enough to get the proportions back without overcooking it, so that you look a bit like a rabbit. Yes. Yes.
Jeez.
So, and then it becomes very interesting. So if I talk to my colleagues who work in New York, they're like, there's a certain proportion and a certain height that goes with a lip lift. I talk to my colleagues in LA, they've got a totally different aesthetic going on, where it's like, no, that's not enough. We got to go hard. And their look would be unacceptable in New York. And then Australia sort of sits somewhere between New York and LA.
Yeah.
But a lip lift is a good procedure, relatively straightforward, often then combined at the same time as some other facial surgery. And it makes a big difference. Done well, it makes a very big difference.
Interesting. And the downtime?
Well, we're going to have some stitches that need to come out at a week. So you're probably out of the loop for a week. But after that, you're pretty much out the door. But I tend to always say 2 weeks, just in case someone gets a bruise or something that holds them back. So almost everything is 2 weeks, 2 weeks. Good photos,
gotcha.
6 weeks, 6 weeks.
Gotcha. So I wanted to talk about the risks and what can go wrong.
Yes.
So what can go wrong in facelift surgery?
So I have this conversation with the patients. All surgery's got risks and downsides. And then my job is to minimize the potential downsides and potential risks. So in surgery, I tend to think about the good, the bad, and the ugly. So to put it really simply, I want good. I want a good result. You're in, you're out, you're happy, I'm happy, we're done. That's good. Bad is that bad things can happen, but they're fixable. So into that category, we have problems with bleeding, and then we have problems with infections, and we need antibiotics. And then one scar may not be as good as the other one. We do a small scar revision, but it's bad, but it's all fixable. Then we get into the ugly, and ugly just can't happen. So we don't do operations necessarily in the back of the office. We don't do them on a Friday afternoon. We are going to a real hospital with a real anaesthetist, and we're going to do this once, and we do it properly, because there are some ugly things that can happen. And Australia is not a third world country, so let's not do third world medicine. Let's do first world medicine and do things safely and properly. But there are certainly stories out there, and the internet's great for two things. It's great for the best of and the worst of. So you will see the best of the facelift, and you'll see the worst of the worst. So, there's pulling on skin, there's blood flow in skin, there can be skin loss problems. There's nerves that go to muscles, and they're like fiber optic cables. And if they get cut, then we lose power to muscles, and we can have all sorts of problems that in well-trained hands, done properly in a real hospital, really shouldn't happen. But everyone needs to think about it, and every patient needs to know about it, because as I also say to the patients that, although the chances of this happening are 0.00001%, if it happens to you, it's 100% your problem. And then it falls on the practitioner. Well, what am I going to do about it if I don't have an outcome that's perfect? Well, I'm going to fix it. I'm going to go hell and high water to get that person who's gone off track back on track as quickly as we can. and, get them the result that, we had a verbal agreement that we were going to try and get to.
Mm.
So in Australia, we're very, very lucky that we have certain medical standards, we have certain medical boards, we have certain societies with codes of conduct and codes of ethics. And I think that's the thing that you get in Australia that you may not get in some other countries.
Mm.
So surgery from other countries is a bit of a bugbear for us because the duty of care is not there. The outcome is not just an operation. It's the discussion, it's the operation, it's the aftercare. So jumping on a plane, flying across to somewhere, flying home, being a heck of a long way from your doctor if you think there's a problem is really quite challenging for some patients. And they can find themselves in a bit of a pickle, and getting out of that pickle can be somewhat challenging as well.
Yeah.
So I'm very big on high standard of care, informed consent, ethical practice, and just maximizing results. But people, they do need to be aware that in the wrong hands, things can not go as planned.
Yeah. So how important is someone's emotional state and expectations going into surgery?
Oh, massively important. So I mean, we know psychologically that after surgery, there's a massive outpouring of emotion in the sense that, like, it's almost like the baby blues in the sense that 9 months has gone into this moment that's coming, and then this moment happens, and then all of a sudden, we're done.
Yeah.
And there can be a bit of an emotional downturn, so that we're very ready for that. We're totally ready for that. And then if someone's not coming from an emotionally stable foundation, they're very vulnerable to finding themselves on the other side going, oh my God, what have I done? This is, what have I done? I want to reverse this. And that's not a good place for anyone to be in. So we're very big on just psychological screening before procedures to make sure people are in the right place. And if we see something that I think might be a red flag psychologically, then that's as important to me as a red flag anatomically. And there'll be cases where you just go, look, at this particular time, this is not the right decision for you. We need to just tweak a few things a little bit. So if someone comes in and their blood pressure's too high, I'll send them to a cardiologist. And if their blood sugar's too high, I'll send them to an endocrinologist. And if their mental state is not ready, I'll send them to a psychologist. So that everyone is all on the same page and everyone's ready for the emotional roller coaster that a big surgical procedure can be.
Yeah, that's good practice. And I just think there's probably still some shame that women carry around
Oh, totally.
fixing themselves, right, in inverted commas, because and then you think about your belief systems around aging. I mean, there's so many different layers to how one might feel before the surgery and after surgery. I'd imagine it would be an emotional ride regardless of whether you have poor mental health or not.
100%.
Yeah.
And there's mother guilt. Mother guilt is mother guilt. I know mother guilt well. It's like
it's a real thing.
Yeah, I know. It's not about me. It's all about the kids. It's always been about the kids. So now it's about me. I feel really bad about it. It's like, you shouldn't feel bad about it. Your kids are fine about it. You're just not feeling good about it. And that's a real entity, and we face that a lot. So there's a lot more to a good surgical outcome than an operation. Put it that way.
Yeah. Yeah. Would you ever have a facelift?
I don't know. People ask me, and I don't know. It's a time and place thing. I think they're great at satisfying individual patients' needs and concerns. I may get there. I'm not sure. I don't know.
Do men get them? Is it common that a lot of men get them?
So honestly, about one in 10% of any practice is going to be male. So about 1 in 10 of my facelift patients are going to be male, and it's often, lived a hard physical life or a hard outdoor life, and not as young as I'm feeling young and sporty and fit, but I'm just not seeing myself in the mirror. So it's exactly the same sort of psychology and concerns, but about 1 in 10 patients is going to be male.
Interesting. And I want to touch on as well, I know some people listening to this might go, oh, it's all very good and well if you've got money and you can afford to do these things. And like anything in life, you invest your money where you see it is
Yeah,
valuable
totally.
to invest
Absolutely.
it, right? So I certainly don't want there to be any judgment. This
No,
is a
no,
personal decision for a lot
no.
of people, but there are things that you can do in order to have great skin
Yes.
and structure throughout your life. It just comes down to maintenance with
Yeah.
anything, right?
100%. And then something something like a facelift, you do need to maintain your skin. I can move structures and reposition things, but I can't change the cells in your skin. But you
Mm.
can. You can, stop the ongoing damage by staying out of ultraviolet light. So hats and sunscreens essential. You can use a skincare program that will actually reverse some of the sun damage. There's definitely ways non-surgically to rejuvenate the face.
Yeah,
Absolutely.
yeah,
And sometimes they're a lot easier and a lot more accessible. Sometimes they definitely couple with surgery to get the best result possible. But I'm with you. It's like different horses for different courses. Some people need a Harley Davidson. Some people want a jet ski.
yeah,
Some people want something surgical. It's not my place to
that's right. Make
sort of
judgment.
make judgment on what each person does and doesn't want.
Mm, yeah. And if someone listening is considering a facelift but feels unsure or overwhelmed, what advice would you give them?
I mean, go and speak to a professional. It's going to take about 45 minutes out of your time as a consultation fee, undoubtedly, but it will clarify what all of the noise out there means in your circumstance. It'll
Yeah.
distill down what everyone's talking about, how that applies to you. And I would go to a fully qualified surgeon, the Australian Society of Plastic Surgeons. We all uphold a code of ethics. We will steer people down the right path, with their best interests at heart. And that is often what people just need. They just go, okay, now I've got a grip on it,
Uh,
because everyone out there is quite often a self-appointed, poorly informed expert. So friends are giving you advice, and then this person's giving you advice, and then chat rooms are full of advice. It's like how that advice applies to you specifically can only really come from someone who has a complete understanding of all the options, and
mm,
that you can find from a good plastic surgeon.
good advice. And is there anything we're missing today? Is there anything we haven't touched on that you feel like it needs to be shared?
I think we're doing pretty well. I think we've covered a lot. I could talk about this for forever,
Yes.
ever.
Well, it's certainly been a ride. I've found it really interesting. There are
Yeah,
questions that I've been wanting to know as a 50-year-old woman.
yeah,
And I think most of my friends, we are curious about it. So it's nice
100%.
to get this information. So I want to finish with a moment of reconnection. And I know in part one you've answered them, so I've shaken them up this time.
Excellent, excellent. This is always fun.
What what do you think people are really searching for when it comes to aging well?
A long time in the summer of their life. That's what they're after. They're after, we've all got memories of, that day, and that day is obviously in the past. And that was a great day. And I want to have that day again and again and again and again. And we're trying to maximize the good days, the days when you get that great vibe, when you just go, you know what? That was great. That's
Yeah,
what I think people are looking for. People are looking for be their best selves and not be someone different, just be the best version of themselves.
yeah. Has your perspective on beauty changed after years of working in this field?
Yes, yes, it has. There's structural guidelines to beauty. There are numbers and there are rulers and there are angles and distances, and they do apply. But then, the concept that beauty comes from within is absolutely true. Is that someone who has a certain joie de vivre, walks into a room with a certain air of lightness and happiness and smile. That's the attractive person in the room, and that's
Yeah,
got nothing to do with numbers and angles and distances. And that often is what surgery will do as well. It will, many times, you'll make a change in someone anatomically but it's the change that occurs psychologically for them that then
Mm.
lets them flourish, and out they come. And you just go, poof, you are like
Yeah.
a totally different person, and
Yeah.
you are glowing. And that is, to me, a beautiful result.
That just reminded me of a girl I used to model with in Brisbane many, many years ago. I've even forgotten her name, but she was flat chested
Hmm.
and had sort of a pixie haircut, was very shy, really pretty, but just very awkward. And then she went and got her boobs done, not huge, but got herself a good pair of boobs.
Yep.
And it just,
Off she went.
transformation, not
Totally.
in just how she looked, but it was her confidence and how much
Yeah.
she elevated. And
Yeah.
so obviously not having boobs had impacted her whole life,
Totally.
right? Might
Totally.
not have impacted me the way it impacted her, but it
Yeah.
impacted her. And it's like when people go and have a nose job, every day they're
Oh,
living with their nose that they can't
yep.
stand, right? So I just think, we shouldn't be judging these people that want to make
100%.
these decisions.
I'll give you a great story to finish on. So
Mm.
one of the best ones, I do a lot of rhinoplasties, and
Mhm.
you take a 18, 19-year-old girl who is quiet, introverted, and super shy, and usually mum will bring her in. We talk about rhinoplasty. Dad invariably comes in. He's like, "Don't you be spoiling my beautiful little princess. Don't you be, she's beautiful the way she is." And then you'll do this operation, and they'll come back for follow-up, and he just goes, "I cannot thank you enough. You have transformed her." I'm like, "No, all I did was change the nose." And they're
Yeah.
like, no, she's outgoing and she's fun and she's having a great
Mm.
life. And I'm like, yeah, it was always in there. She was just held
Yeah.
back. She just needed that little step forward. And
Yeah.
that's a great thing to be able to do.
And, and some may argue that there's that self-acceptance piece, and sure, there are elements of that with anything in life, but I just
Totally.
think if there's subtle changes that you want to make in your personality. I mean, we do it with makeup.
Yep.
People wear a lot of makeup at times, there's enhancing or
Yep.
taking away from or doing whatever. So I just think there are so many different layers to it.
It is good. It's fun.
Mm.
It is interesting to work around those layers
Mm.
and find out if you can tap into the right layer that needs to be changed to get that result, then that's the art behind the science that then creates good outcomes for me.
Mm. Well said. Dr. Jeremy Hunt, thank you so much for
Oh,
such an
my pleasure.
honest, grounded conversation around a topic that so many women are thinking about, yet often feel nervous to ask openly. I think this episode really helps cut through the noise and fear that surround cosmetic surgery and aging. Whether someone chooses to have a facelift or not, I think the most important takeaway for today is that aging well doesn't mean chasing perfection. Is about feeling informed, feeling confident, and ultimately still feeling like yourself.
100%.
Yeah.
Absolutely. Well said, Tracy. Well said.
Thank you.
My
Thank
pleasure.
you.
My pleasure. It's been great.